Well, good afternoon, and thank you for joining us. You should have received our news release. DHS confirms additional cases of measles in Oconto County, indicating community spread. You can also find that on the DHS webpage. And joining us to answer your questions today are Tracy DeSalvo, the director of the DHS Bureau of Communicable Diseases, and Dr. Stephanie Schauer, the Wisconsin Immunization Program Manager. And we'll begin with remarks from BCD Director Tracy DeSalvo.
Thanks, and good afternoon, everyone. My name is Tracy DeSalvo, and I am the Director of the Bureau of Communicable Diseases here at the Wisconsin Department of Health Services. Thank you for joining us today for an update on measles in Wisconsin. Today, we are reporting that we have identified 5 additional cases of measles in Oconto County. This brings our total count of measles cases in Wisconsin to 14. Based on the public health investigation, these 5 new cases are linked to the initial 9 cases we reported earlier this month. The 14 cases in Wisconsin range in age from 7 months to 53 years old. Onset of rash for these individuals ranges between July 15th through August 20th of 2025. Based on our investigation to date, the majority of cases are unvaccinated. At this time, there are no hospitalizations to report, and we have not had any deaths due to measles in Wisconsin. To protect the privacy of personal health information, we are not releasing any individual personal health information about these cases. Our local public health agencies in Oconto County and neighboring jurisdictions are actively investigating these cases and are working to identify and directly notify people with known exposures. At this time, the investigation has not identified any public locations where we aren't able to identify people who might have been exposed. However, the investigation is ongoing, and we will notify the public should any of this information change. These cases are being identified as we continue to see cases of measles across the United States, with cases being reported in 42 states so far this year. Today, our recommendation to the public is check your vaccination status and know if you are protected against measles. If you are not or do not know, please contact your healthcare provider or your local health department to find out and get vaccinated if you are not already vaccinated. Thanks very much.
Thank you, Tracy, and we'll now take your questions. Please stay on mute until you're called on for a question. And since we need to be finished at 2 o'clock, please only one question to start. If we have time, we'll come back around for follow-up questions. And with all that in mind, our first question belongs to Heather Poltrock from WSAW in Wausau. Heather?
Hi, thank you. I know that public health experts have said that there are some adults who should maybe consider getting revaccinated, particularly people who were born in the 60s or vaccinated in the 60s. Could you talk a little bit about that and what those people need to know?
Yeah, sure. So there's a very small number of individuals who were born between 1963 and 1967 who may have received a measles vaccine that's less effective. And for those individuals, they are recommended to receive an additional dose of the measles, mumps, rubella vaccine. It's important to note that this is a very small slice, and for many people, particularly those who are born in or after or before 1957, are already considered immune. If you have at least 1 dose of a measles-containing vaccine outside that time period, you're considered up to date. And we do recommend that children have received 2 doses of the measles, mumps, rubella, or MMR vaccine.
Thank you. Now to Nina Spirano from NBC 26 in Green Bay. Nina?
Hi, thank you for taking my question. We know measles is very contagious, but what is the probability of you contracting the virus if you are not vaccinated versus vaccinated?
Yeah, that's a great question. So if an individual with measles is in an indoor space or a room, and there's 10 individuals who are not protected, we anticipate that 9 out of those 10 will come down with measles. The other thing to keep in mind is that the measles virus is very infectious in that if someone is in an indoor space with measles and leaves, the virus remains suspended in the air for up to 2 hours, and someone who is not protected, if they come in during that time period, can contract measles. So there doesn't need to be a face-to-face opportunity for infection. And this is why it's so important to ensure that people are protected against measles, because it is one of the most highly infectious diseases that we have.
Thank you. Now to Mattie Heim from the Green Bay Press Gazette. Mattie?
Thank you. I'm wondering if you could say a little bit more about how these new cases were exposed. Were they people who were on the health department's radar before they tested positive, like people who were quarantining or were already identified in the contacts of the initial cases?
So I can't speak to the specifics about the individuals in order to protect privacy, but they were identified upon investigation and realization of their case that we were able to tie them back to the original 9 cases.
Thank you. And now to Kimberly Wetzel from the Wisconsin State Journal. Kimberly?
Hi. You mentioned that the investigation is still ongoing. Is your investigation happening in counties outside of Oconto County? And if so, where else are you conducting an investigation to see if there was any other exposures?
Yeah, so Oconto is the main thrust. We have certainly notified other local health departments in the surrounding areas and healthcare providers because we know that disease doesn't stop at borders. So it is important that folks in the area are aware, particularly healthcare providers. Should folks seek services or if someone's not feeling well, we want to make sure that that they are appropriately ready for those. So we are making sure that across the state, healthcare providers and the public are aware of these cases and are doing all that they can to protect themselves and prevent further spread.
Thank you. Now to Kyle Jones from WISCTV in Madison. Kyle?
Hey there, thanks for having the call. We're getting close to that time of year where there's going to be a lot of big gatherings. I'm thinking back to school and then up near Oconto County, I'm thinking, Packers games at Lambeau. Is there a fear of these big gatherings turning into super spreader events for diseases like measles?
Yeah, I mean, I think, we are always concerned about measles spread. As I mentioned, measles is very infectious, and it doesn't matter if it's a small group or a large group. The important part is how well protected those groups are. The measles vaccine, 1 dose is 93% effective and 2 doses is 97%. And so we really encourage, whether you're traveling or playing, doing what you want, make sure that you're protecting yourself so that you don't have to worry about going to events or getting together with folks and coming home with an illness. And so it's just good practice to make sure that you and your family are protected. If you're unsure, check with your record in the Wisconsin Immunization Registry or the WIR. Alternately, you can call your healthcare provider or local public health. They can help you figure out if you are not immune and if you need to be vaccinated and can assist. One thing I'd like to really make sure that we mention is the Vaccines for Children program. This is a program that can offer vaccines to eligible children who are Alaska Native or American Indian, who are uninsured, or who are on Medicaid, and they can receive the MMR vaccine at no charge. This is a program that is throughout the state, over 720 providers, and it's likely already the provider that you see with your children is already part of this network. And so we don't want any children to miss an opportunity to be protected because we've got this network. And really, there's more information on our website about the Vaccines for Children program. In addition, adults who are uninsured may be able to receive a dose of MMR through the Vaccines for Adults program. And there's also information on our website for that network as well. So really such an important piece that cost should not be a barrier to folks getting the protection they need.
Okay, now on to Samantha Cavalli from WBAY TV in Green Bay. Samantha? Again, Samantha from WBAY TV in Green Bay. Okay, moving on then to Rob Mentzer from Wisconsin Public Radio. Rob?
Thanks for the information. Thanks for doing this call. Just, I guess, since there was a notice just a few days ago about possible measles exposure elsewhere in the state, do you have any more information that you can share about the out-of-state traveler in southern Wisconsin?
No, we don't have any more information that we are able to share. The information that we've put out should, help in identify if folks were exposed and what to do. That information is for folks who were St. Croix and Rock County. You can see that there were 2 locations on August 4th. And so if folks were in those locations at those time, it's an important point to make sure that they are protected. And if not, contact their healthcare provider. Certainly, if anyone has been exposed and not sure if they were immune, it's important, and they're developing symptoms of measles, which can be cold-like, can be a runny nose, cough, red watery eyes. They may have a fever, and then the rash will probably come out a couple days later. If they have any of those symptoms, it's so important to call ahead to your healthcare provider so that they can be prepared for you and make sure that if indeed you have measles, that it's not spread to anyone else. So important to call ahead to healthcare if you think you may be coming down with measles.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Sean.
Thanks for holding this. Can you give some idea of how many people may have been exposed to this, or how many folks are contact tracing? Just kind of like how many folks could be affected by this right now? Thank you.
Yeah, I don't have the numbers. Much of this investigation is happening at the local level, and they do work. How the public health piece works is that when there's a suspect or confirmed case identified, the local public health will work with the individual to identify, where they've been and who they've been in contact while they were infectious. And I will say that is a 9-day period, and it's sometimes maybe a week or 2 later, and they're not feeling well, and so they're trying to recall that. But once they've got that information, they then can go ahead and reach out to individuals who have been exposed, and that's the process that is happening right now. In some instances, there may be locations where we can't know everyone who was at the location, such as the exposures that we noted earlier in the week. We don't know who all was in some of those public places, and that's where a public notification is really needed. At this point, we're not aware that there's any need for public notification, as they are currently working through and contacting those who have been exposed to the most recent cases.
Thank you. Now, Jennifer Eisenhart from Southern Lakes Newspapers. Jennifer. Jennifer from Southern Lakes Newspapers. Okay, we will start then from the top for any additional questions and go back to Heather Poltrock from WSA WTV. Heather?
Thanks. I don't have anything else.
Thank you. Nina Spirano from NBC 26 in Green Bay. Nina?
Thank you for taking an additional question. Initially, you said the risk to the public was low initially. Would you change that classification now?
Yeah, so I mean, unfortunately, low does not mean zero risk. And, as we have seen and we've identified that there has been some transmission in Wisconsin. And so, I will note that with measles, any exposure can be consequential because it is so highly infectious, and that a low risk situation can quickly change based on one single additional exposure. And so that's why we are continuing to, have opportunities to help spread the word about the importance of protecting yourself. One thing I omitted to note is that if you're not vaccinated, but you think you have, one option is that you can get a blood test done to see if you are immune. If you're not, you will then, need a dose of the MMR vaccine. And it's not harmful to receive an additional dose of vaccine, even if you had one, but you couldn't find the documentation and aren't sure. So
is the risk still low? Are you still classifying the risk as low?
I think we're still in the middle of the investigation, but I believe public health is contacting and working with all of those who are affected. So we don't have some of these, more public, larger exposures that we are aware of at this time.
Thank you.
Thank you. We've heard from Jennifer Eisenhart from Southern Lakes Newspapers, and she writes, I'm wondering what birth year would be considered the cutoff for being considered fully vaccinated.
So, as noted, those born before 1957 are generally considered immune, although they certainly can receive an additional dose, and many may do particularly if they're traveling internationally. But that's where because measles was so circulated and most everyone had disease during that era, we consider those immune. All other adults should have one dose, and as I said, the children generally, probably 25 years and down, have had the recommendation for about 2 doses. It's typically given, first dose is at 12 to 15 months, and the second dose is at 4 to 6 years, just before kindergarten entry.
Thank you. Now to Mattie Heim from the Green Bay Press Gazette. Mattie, another question?
Thank you. Tracy had mentioned earlier that the majority of the folks who have contracted the disease are unvaccinated. Is there any more specificity you could offer there, a percentage? I'm just trying to gauge, is that, 51%, or is it, the large majority?
Yeah, we don't have that information other than because the information is still being gathered. I will say if you look at the national data for the 2025 outbreaks for the U.S., about 92% of the cases that have been identified nationally are unvaccinated. So I think that really speaks towards the effectiveness of the MMR vaccine. It's important to note that this vaccine has been used for over 50 years. I got it as a teen. My kids who are in their 20s got it when they were small, and kids today are still getting the same vaccine. This has a long track record of really providing good, robust protection, and over 575 million doses of this vaccine have been used worldwide. So it really speaks towards the robustness and the longevity of protection from this vaccine.
Thank you. Now to Kimberly Wetzel from the Wisconsin State Journal. Kimberly, another question?
Yeah. You had mentioned that, typically first doses are given out, at the earliest at 12 months, but we have a 7-month-old who contracted the disease. So I guess my question is, what do you recommend parents who have really young kiddos who don't have the ability to be vaccinated yet? What kind of precautions should they be taking to prevent, their children from contracting measles before they can be vaccinated?
Yeah, it's a really great question. I think first is, as you noted, we typically don't vaccinate below 12 months of age. There may be exceptions in large outbreak settings where that could be temporarily changed and slightly younger children vaccinated, but at this point we're not there. So what can parents do? First is make sure everyone around your children are fully vaccinated. It's important that you ensure that the home is protected, and then being mindful of, not taking children into situations where there may be ill individuals. If people are traveling, you can certainly check the CDC website. They do have information about where measles is circulating internationally, and some parents may have to make some hard decisions about perhaps deciding not to travel to a location where there have been cases of measles. I know it is anxiety provoking, and parents wish they could do something, and unfortunately, once they get to 12 months, then we can do something to protect them, and the best that we do then is ensuring that we ourselves are protected as well.
Thank you. Kyle Jones from WISCTV in Madison. Do you have a follow-up?
Can't say I do. You got everything I was looking for. Thank y'all for holding this once again.
Thank you. We'll try once again for WBAY TV in Green Bay. WBAY, do you have a question?
I do. Can you hear me?
Yes.
Yes, we
Awesome.
can.
Thank you. Okay. Thank you again for coming back around in the question. So I have kind of 2 questions. My first one is the last line at the end of the press release. it mentions at this time the investigation has not identified locations in public settings for which a full list of exposed people cannot be obtained. So could this, I know we're not saying where publicly, but is there like if whoever was maybe exposed, is it like just generally kind of like walking around like in a park or settings like that? And then also too, with school coming up in the next few weeks, starting up there, has there been a lot of communication with the school district?
Yeah, so, I mean, in terms of the local health department, as I mentioned, certainly works with individuals to identify those who have been exposed and to work with them. And they do that, you know, working one-on-one, connect with the individuals. And so that's where this investigation is at, is that local public health is really reaching out to all of the identified contacts to, you know, determine if they are not immune and if they need a dose of vaccine, or if we need to have a titer done so that they can feel reassured that they are protected, or to give counsel on what to do if they do develop symptoms. So that's the stage and what's happening right now. As I mentioned, you know, in that course of the investigation, they have not identified any situations where we would need the general public to be aware and say, if you were here on this date. So hopefully that answers the first question. And then regarding schools, you know, it's MMR is a requirement for school entry. And so we know that schools do collect and that information and track it and make sure that all children have the opportunity to be vaccinated. We know certainly that you know, some families choose not to vaccinate, but we really want to make sure that the communities where we are gathering have as high of protection as possible. With measles, you want to be north of 95% of individuals covered so that we don't have continued case transmission, and that's a pretty high number. And healthcare providers and local public health and school personnel are all working together to make sure that families know about the vaccine and know how and where to obtain it. And I guess I would add, this is where the Vaccines for Children program is so important, that families are aware that if they do need to have their children vaccinated, that can be done without cost to them.
Thank you. Now to Rob Menser from Wisconsin Public Radio. Do you have another question, Rob?
I think I'm good. Thank you.
Thank you. Now to Sean Kirkby again from Wisconsin Health News. Sean.
Thank you. Do you have a breakdown of how many cases are kids and how many are adults?
I don't have it, but I will say the majority, I believe, are in the school-aged area. And we will be posting more information on our website next week. So you can check there for a bit more information. As I said, we won't be releasing individual information, but aggregate information.
Thank you for that. And I know that Jennifer Eisenhart from Southern Lakes Newspapers had a follow-up question in the chat concerning, she had asked a question about the cutoff age, and then she asked about, I'm trying to get to your question. What about middle-agers above 25, but after the 63 to 67-year-old window?
Yeah, they should have at least one dose of measles, mumps, rubella containing vaccine. Depending on how old you are, they're often, because of the measles outbreak in the late 80s, a recommendation was made for individuals in universities and sort of down to receive a second dose. So many of individuals in that age group probably have 2 doses. Additionally, if you work in healthcare or if you're traveling internationally, you should have 2 doses. But if you're in that middle, as long as you've got 1 dose and you're not in one of those special high-risk groups, you should be fine, with that slight caveat that if you received a dose between 63 and 67, check with your healthcare provider, as you may want to go ahead and get an additional dose just to be sure.
Thank you. And we have time for one more question, and we'll go to Samantha Cavalli from WBAY TV in Green Bay. Samantha?
I actually answered I got my 2 answers question earlier, so I'm all good.
Sounds good. Well, with that, we will conclude today's media availability. Our thanks to Tracy DeSalvo and Stephanie Schauer and all of you for participating. Any additional questions you have can be sent to DHS Media. We thank you and have a good weekend.